Hi, I'm Lisa, one of the board certified nurse practitioners here at the Skincare Center. We're going to talk about some tattoo removal. So come with me, we're going to go take a look at our laser. So when you first come in, we're going to come and talk to you about what type of expectations you have, how long your tattoo has been there. I'm going to take a look at it and see what color ink you have. That will change our plan a little bit if you have dark ink versus blue ink or red or white. So we want to take a really thorough look at to see what kind of ink that you have. And we'll come in, this will be the chair that you'll sit in. So you'll have a seat right here. We'll look at that tattoo. There's a couple of different options that we can do for numbing. So we can use something like ice, or we can inject lidocaine underneath the skin, and we can also use a topical numbing agent. Some patients don't want anything. So if you're one of those that's strong, then we don't have to use anything for you as well. After we sit down and have your tattoo numb, I'm going to use this handpiece here. The machine's called a PicoSure. It have great results with it. We have multiple different lenses that we can use. So if you have the standard color like the grays and blacks, then we'll use this handpiece. We do have another one that we use for all of our sunset colors. So that would be your oranges, your yellows, and your reds. So depending on the color of the tattoo, we will use a different handpiece for it. All right, so as we get the tattoo removal going, I will have you wear either a pair of glasses. So if your tattoo is somewhere like on your arm or your legs, then you can just wear these regular shields. If it's somewhere like on your face, then we'll use eye shields over you. And that's just to protect your eyes from having any damage from the laser. Then we'll get started. So the laser is a little bit warm. As we get started, the tattoo removal process is going to be a little bit painful. So if you need us to stop for a moment to take a break, we can definitely do that. If you're using the lidocaine injections, most of the time you don't need to have any little breaks in there, so keep that in mind. There is an increased charge for the lidocaine injections. That will be going over in your consultation. As far as pricing goes, we charge per appointment. So if you need multiple sessions, which most people do, you're going to pay each time that you come in. So the sessions usually range from anywhere from 10 up to 20 sessions, depending on how long the ink has been there, how deep it is in the tissue, and if there's any scarring. Sometimes we can feel on the tattoo, and you can feel that there's actually a scar. And if you have a tattoo now, you can feel if it's raised, we've got some scarring. So there may be an option that we need to do a little bit of scar removal in addition to the tattoo removal. After we're done with the laser tattoo removal, we have a couple of different processes that we do. We'll put some Aquaphor on you, and we bandage up the tattoo, and then we send you home with your aftercare instructions. So that would be things like keep your bandage on for 24 hours, no sun exposure for a week, and no submerging your tattoo underneath the water for at least a week as well. There are some things that can happen the first couple of sessions, and that could include blistering of the tattoo. You may have some redness or scabbing, and that's all normal healing process. If you ever have a question about whether it's normal, you can give us a call, and we'll be happy to answer those questions for you. Then we do a follow-up appointment with you to do your next session. So those are typically anywhere from 6 to 8 weeks apart. We like to look at your tattoo removal as a long-term process. So this is a commitment. If you're going to be getting it removed completely, you may see us for about 1.5 to 2 years. So keep that in mind. We do have a big military presence in Pensacola, so I like to refer people to other people who have the PicoSure laser if they're being changed to a different location. So just keep that in mind. It's going to be a long-term process. It's not going to be a one and done. If you have a stick and poke, which they call the garage tattoos where somebody did that, a lot of times those will move a little bit easier and faster. So the consultations where we're going to give you a lot of that information and set your expectations in the correct route there. So even if you're not ready to start the tattoo removal process, it's okay to come in and have a consultation. That way, when you're ready, you have all the information that you need to start that process. You can call to schedule your consultation at 850-474-0155.